Hello everyone, welcome to our next video that is on irrigation regimen in root canal system. So the chemicals that are used to clean the infected canals, they should be administered in such a manner that they actually unleash their full potential on their targets in the root canal system rather than act on each other. So a hypochlorite solution should be employed throughout instrumentation, which is a universal fact. So we have to make sure that how it should actually act on the microorganisms in the root canal system rather than acting on each other, that is with EDTA or citric acid or chlorhexidine. So we should all remember one thing, that canals should always be filled with sodium hypochlorite, as this will increase the working time of the irrigant, which is what we all want. And in addition to that, the cutting efficiency of the hand instruments is also improved. So the irrigation regimen: between instruments, canals should be irrigated with copious amounts of hypochlorite solution that varies again between 3% to 5.25%. Then after the completion of the cleaning and shaping procedure, the canals should be thoroughly rinsed with aqueous EDTA or citric acid. That is your 17% EDTA solution. So generally, each canal is rinsed for about 1 minute using 5 to 10 ml of the chelator irrigant. As such, there is no clear-cut recommendation for this time procedure. Along with that, we should also remember that prolonged exposure to strong chelators such as EDTA may actually weaken the root dentin. So we'll just keep it for a minute. Now, there are many protocols which are followed, whether we should irrigate, continuously between EDTA and sodium hypochlorite, that is more efficient, or whether we should continuously irrigate with sodium hypochlorite and then just give a final rinse with EDTA. Is that more beneficial? See, whatever you do, you have to remember that it should be done properly with the right time and the right concentration. One thing that we all have to remember is, please do not mix the irrigants. For example, what I mean to say is, you're irrigating with the sodium hypochlorite solution. Now, if you want to irrigate with EDTA, either dry the canals with paper point or irrigate with the distilled water or saline in between the two solutions. With this, what happens is, they will not act on each other or reduce each other's efficacy, and simultaneously they will be acting with their full potential inside the root canal system, and no precipitate will also be formed. Another important factor is whether we are going to give an intervisit dressing or not. So when we have to give calcium hydroxide, the final rinse should be sodium hypochlorite, as these two chemicals perfectly are they complement each other. So you can irrigate with sodium hypochlorite, and then along with that you can place calcium hydroxide dressing. That will not be an issue, and it actually appears to be advantageous as compared to irrigation with saline. Now, this is another picture which I posted, I think a few weeks back on my page. This is a reaction between chlorhexidine and sodium hypochlorite, which is the orange precipitate which is formed. This was given by Hapsalo in his article. So there are cases where we have to use chlorhexidine. So chlorhexidine is mainly indicated in retreatment cases where it can actually act against high proportions of gram-positive bacteria in the root canal system and E. faecalis. So the property that we all should remember is substantivity by chlorhexidine, which is advantageous as compared to sodium hypochlorite. So when we are going to give chlorhexidine, we have to remember that if hypochlorite is present in the canal, then this is what is going to happen. It is going to form a precipitate, and this precipitate is actually shown to have mutagenic potential as well. So we have to make sure that this is not formed if we have to use chlorhexidine. So in such cases, what do we do is, when you have to give chlorhexidine gel as a inter-canal dressing, or you have to irrigate with chlorhexidine, make sure that you dry the canal with paper points and then use chlorhexidine, or use saline before you use chlorhexidine. And another option is that you can irrigate with lots of chlorhexidine so that there is no hypochlorite left in the canal. So I think it's easier if we can go with saline or paper points rather than wasting your irrigant. So this is a very important thing. Along with that, when we see EDTA and sodium hypochlorite, we should remember that EDTA is shown to decrease efficacy of sodium hypochlorite in some articles and in some studies. So if we have to avoid that, again, better we should just dry it with paper points and use saline in between, because we don't need to take that risk if it is a simple procedure. So just remember these few bits when you are doing irrigation. All these points are actually taken from this article by Zender that is on root canal irrigants. It's a very explanatory article. Please go through it if you all get time, and you'll actually understand how to go about the irrigation procedure and how each irrigant is important and how it reacts with the root canal system. So that's all for today. I'll see you in my next video. Have a good day.